Welcome to Dr. Khares Differential Diagnosis. Today we are going to learn normal or anatomic radiolucencies seen on the dental radiograph. So this is the intraoral periapical radiograph of mandibular posterior region showing mandibular canal. Mandibular canal delineated by two thin radiopaque lines can be seen. Radiograph A shows canal in the edentulous jaw while radiograph B shows canal in the dentulous jaw. The mental foramen appears at the anterior terminal of the canal. This is an IOPA of mandibular posterior region. The continuation of mandibular canal anterior to the mental foramen can be seen. Notice the short vertical radiolucent band, mental canal, emanating from the superior margin of mandibular canal near the arrow. This is the IOPA of premolar region showing mental foramen. Both A and radiograph B shows mental foramen by the arrows. Occasionally, the foramen is projected near or over the roots of adjacent teeth and may be misinterpreted as periapical pathosis. This happens especially when the pulp of the teeth are suspect. These are the radiographs showing mandibular foramen by the arrows. The radiograph A shows the lateral oblique projection, while radiograph B and C are the dry specimen. The mandibular canal leads anteriorly from the foramen. This is the IOPA of mandibular anterior region showing lingual foramen. The radiograph A shows a single foramen which is accentuated by the radiopaque projection of genial tubercle that usually encircles it. The radiograph B is showing the double foramen. Here the radiograph A is the pentamographic view while the radiograph B is the cephalometric view showing airway shadows. So one is the nasopharyngeal airway while 2 denotes oropharyngeal airway. This is the IOPA of mandibular posterior region showing mandibular fossa. The radiograph A shows the fossa which appears as poorly defined radiolucency below the physis of molar. While in the radiograph B, the prominent mylohyoid ridge shown by the arrow is seen in this view, accentuating the fossa. This is the intraoral periapical radiograph of mandibular anterior region showing mental fossa. This radiograph showing a generalized radiolucency in the periapical incisor region illustrates the thinning of bone resulting from the mental fossa. This radiograph of a stillborn child shows the mandibular and the intermaxillary symphysis at birth. This vertical shadow may be erroneously identified as a fracture. Here in the picture A, arrow indicate the presence of a medial sigmoid depression on the medial aspect of the bone. The radiograph B is the panoramic projection showing the sigmoid depression. Here the radiograph A, B, C and D all shows presence of pseudocyst of the mandibular condyle. This is the intraoral periapical radiograph of maxillary anterior region showing intermaxillary suture and incisive foramen. The intermaxillary suture can be identified as an indistinct vertical radiolucent line in the central incisor region which can be seen in the radiograph A. However, it is more apparent in the radiograph B. The incisive foramen which is shown by the arrow represents the oral terminal of the incisive canal. It is frequently projected on the central incisor region near the crest of alveolar process. The foramen of nutrient canal is located inferior to the incisive foramen. In the IOPA, arrow indicates the nasal terminal of incisive canal. In the IOPA-B, the paired radiolucencies at the superior border represents the nasal cavities. Arrows indicates the divergent branching of incisive canal towards their nasal terminal. The faint image of the nose and outlines of the nares, which is shown by the arrows, are seen in this periapical view of maxillary incisor region. The radiograph A is periapical while B is the occlusal view showing nasolacrimal canal by the arrows. A. The structure is not usually projected on periapical film. Radiograph B. On maxillary occlusal films, the nasolacrimal canals are frequently misinterpreted as greater-palatine foramina. Note the nasal cavity denoted by 1 and maxillary sinus denoted by 2. These are the IOPAs showing maxillary sinus. In the radiograph A, this periapical view of canine region shows the maxillary sinus by number 1, the nasal cavity by number 2, and the antral by Y. In the radiograph B, maxillary sinus in an edentulous molar region can be seen. In the radiograph C, the maxillary sinus showing complex contour and unusual extensions can be seen, while in the radiograph D, maxillary sinus with a cyst-like configuration can be seen. A nutrient canal, which is shown by the arrow in the sinus wall, aids in differentiating the sinus from a cyst. These are the IOPA showing marrow spaces. Look at the radiograph A. This pattern occurs adjacent to the mandibular molar roots with some frequency. Radiograph B. Large marrow spaces shown by the arrow that was mistaken for a lesion. Radiograph C. Large marrow spaces shown by the arrow frequently occurs in the bifurcation of the mandibular molars. This variation must be differentiated from the periodontal involvement in the bifurcation. Radiograph D. A large marrow space shown by the arrow in the coronite process was mistaken for a lesion. Note the relatively small marrow spaces in the maxilla compared with those usually occur in the posterior region of mandible. These are the IOPAs showing nutrient canals. The radiograph A. These canals are frequently prominent between the roots of mandibular incisors, and they terminate as small foramina on the crest of interseptal bone. Radiograph B. The prominent nutrient canal, which is shown by the arrow in this view, could be mistaken for a fracture. Radiograph C. The prominence of this unusually large nutrient canal or excessive foramen, which is shown by the arrow, is produced by directing the X-rays parallel to the canal. This is the IOPA of mandibular posterior region. Developing tooth crypt of third molar can be seen. The cyst-like radiolucency may be correctly identified by its position in the jaw, bilateral occurrence, the age of the patient, and serial radiograph.